Hello, I'm Matthew Cooper, Director of Kidney and Pancreas Transplantation at MedStar Georgetown Transplant Institute and Professor of Surgery at Georgetown University School of Medicine in Washington, D.C. Thank you for your interest in learning more about FCR001, an investigational cell therapy designed to induce immune tolerance in transplant recipients that is being developed by Talaris Therapeutics. Today, we'll be taking a closer look at the FCR001 treatment protocol in the context of a living donor kidney transplant. To collect and ultimately administer FCR001, both the donor and the recipient must undergo a multi-step process. To mobilize the stem and immune cells necessary to manufacture FCR001, the donor undergoes treatment with granulocyte colony stimulating factor, or GCSF, at least 3 weeks prior to the kidney transplant surgery. The donor's stem and immune cells are collected following mobilization and sent to the Talaris facility in Louisville, Kentucky to manufacture FCR001. Mobilization with GCSF has been associated with adverse events such as bone pain, fatigue, headache, joint pain, insomnia, myalgia, anorexia, and nausea. In the Phase 2 trial, no serious adverse events were reported in donors. Once FCR001 is manufactured and passes all quality assurance and quality control testing, cryopreserved bags are shipped to the transplant center. If insufficient cells are obtained in the first collection, the donor may undergo additional apheresis and collection. The donor then undergoes nephrectomy on the day of transplant. The FCR001 recipient also undergoes stem cell mobilization at least 2 weeks prior to transplant. Recipient stem cells are cryopreserved and stored on-site for at least a year in the rare case of bone marrow failure post-transplant. To prepare the recipient for stem cell transplant via FCR001 infusion, a non-myeloablative conditioning regimen is initiated on day -4 prior to the kidney transplant surgery. Before transplant, the recipient undergoes non-myeloablative conditioning with fludarabine on days -4, -3, and -2. Recipients are also given cyclophosphamide plus Mesna on day -3 as part of the conditioning regimen. Conditioning treatments on these 3 days are followed by dialysis 6 to 8 hours after fludarabine. Immunosuppression with tacrolimus and mycophenolate mofetil, or MMF, starts on day -3. On the day before kidney transplant, recipients receive low-dose total body irradiation. And kidney transplant occurs on day 0, followed by stem cell transplant via FCR001 infusion on post-transplant day 1. Recipients receive an additional dose of cyclophosphamide plus Mesna each day on post-transplant days 3 and 4. These doses of cyclophosphamide are intended to further mitigate the risk of GVHD and are a standard practice in allogeneic stem cell transplant. And to support the expected hematologic nadir, recipients also begin daily doses of GCSF on day 5, which continue until absolute neutrophil count is greater than 1,000 cells per microliter 3 days in a row. Following kidney transplant surgery and FCR001 infusion, recipients are followed and monitored similar to bone marrow transplant patients, including immunosuppression level monitoring and monthly chimerism testing. At 6 months, the first protocol biopsy is performed. If that biopsy shows no rejection and the patient has no donor-specific antibody or GVHD and also has stable renal function and durable T-cell chimerism of at least 50%, MMF is stopped completely. At month 9, no protocol biopsy is performed, but if the other criteria I just mentioned are met, tacrolimus can be weaned to 0 to 3 nanograms per ml. Finally, at month 12, if all the same criteria are met along with a clean protocol biopsy, tacrolimus can be stopped and the patient continues off all immunosuppression. An additional protocol biopsy is performed at month 24. I hope you now have a clear picture of the FCR001 treatment process for both donors and recipients. FCR001 use in living donor kidney transplant is currently being investigated in FREEDOM-1, a Phase 3 clinical trial. To learn more, please visit the FREEDOM-1 study site at freedom1study.com or the NIH clinical trials site. Thank you for your time and your commitment to kidney transplant.